Hello and welcome to today's program. I am Ogechuku Okegwe. The World Health Organization has said Nigeria still has over 2.1 million zero-dose children who are yet to receive any form of vaccination. In his speech at a two-day engagement meeting with religious leaders from northern Nigeria in Abuja by the Sultan Foundation for Peace and Development, with support from National Primary Healthcare Development Agency, Walter Mulumbo, urged the federal government to ensure that its collaboration with the traditional institution continues to be nurtured and sustained. He also urged the traditional and religious leaders to continue to promote increase on antenatal services, uptake and healthy facility delivery, as well as ongoing zero-dosage mapping and immunization recovery efforts through the Planning Big Catch-Up campaign. We'll go on a short break and the program will return. Welcome back. Maintaining good oral hygiene is essential for overall health and well-being. It involves a routine of brushing, flossing, and rinsing to keep the mouth clean and free from harmful bacteria. Practicing good oral hygiene from a young age establishes long life habits. Teaching children to brush and floss daily foster responsibilities and help them understand the importance of taking care of their teeth and gums. To ensure good oral hygiene, there are several key practices to follow. Regular dental checkup are also important. Additionally, consuming a balanced diet, low in sugar and high in fruits, vegetables, and whole grains supports overall health. Maintaining good oral hygiene is crucial for preventing dental problems, promoting overall health, and enhancing self-confidence by adopting a consistent routine of brushing, flossing, and regular dental visits. Individuals can enjoy healthier teeth and gums throughout their lives. Prioritizing oral hygiene is an investment in both immediate and long-term. Well, joining me on the program to give more insights is immediate past President LASUTAD, Dr. Salmon Oladapo. Thank you for joining me on the program, Doctor. So looking at overall health, overall hygiene, how often should one brush their teeth for optimal oral health?
Thank you very much. And of course, I must appreciate TV 360 for inviting me to come and talk more about the oral hygiene. Concerning the question you have just put forward, how often? Number one, there are school of thought, but the most prevalent one is that one needs to brush twice a day. So brushing twice a day with fluoridated toothpaste and of course appropriate toothbrush. Doing this is going to make someone's oral hygiene be clean, and of course any bacteria, whatever that's going to happen there is going to be reduced. So for optimal cleaning of the oral cavity, one has to clean twice a day. First one in the morning. Some school of thought say that as soon as someone wakes up, whereas some school of thought says that no, it's going to be after one has finished eating breakfast. But the second one, which is going to be at night, it means that one is going to brush, and that brushing is going to be the last thing before one goes to bed. So if one brushes, which is the last thing before one goes to bed, it means if you wake up, you can only rinse your mouth with water, then you eat your food, then after eating, you can now brush. So that's the explanation that has to do with the two. But what is recommended is for everybody to brush twice daily. Thank you very much.
So what techniques can improve the effectiveness of toothbrushing?
Thank you. This question is a question that is very common. People that come to dental clinic, they will be asking dentists, what kind of techniques, what kind of, we have a couple of brushing techniques. But the most important is that each of these techniques, there is no one that is superior over other. I want us to get that information clear. But what has been advocating is that combination of all these techniques is what is being advocated. For example, For the children, we have already, the dentists have advocated that they have to be doing what is known as Phones techniques. So it's like a circular technique for the children. And that circular techniques is not the only techniques that is going to be used. So as I said earlier on, for both adults and the younger one, what is being advocated is the combination of all these techniques, whether it's bars, modified bars, and other techniques like that. So that is what has been recommended. Thank you very much.
So for toothbrushes, we know there are different toothbrushes. So what toothbrush are best for different dental needs, that sensitivity or whitening?
Okay, thank you very much. Well, let me try and break the questions down into various. First of all, it is not the tooth brushing that determine how sensitive someone's teeth is going to be. So tooth sensitivity, it's something on its own. All right, whitening of tooth is something on its own. But the toothbrush, there are three types of, in fact, there are four types of brush. You can have the soft, you can have that is soft texture. You can have the medium texture. You can have the hard texture toothbrush, and they can also be very hard texture. The soft texture are recommended for the pediatric patient, the babies, are you getting me, and adolescent. So that is the one that is recommended for them. But for guys that are teens and 20s, medium brush is what is recommended for them. Now, for the hard and very hard, that one should not be recommended. It's not recommended for normal individual. So that one, it is being recommended for the smokers, all right? But what is important is this. Majority of people believe that the harder the brush, the more effective that, the brush is going to be. No, that is not. If one is able to learn the appropriate techniques, all right, be it phones, be it bars, be it modified bars, once you learn all those things and you're able to do it appropriately, your mouth is going to be clean. So that's one thing we need to emphasize so that our people out there will know that it is not that one needs to go and get brush that is going to be as hard as if someone wants to wash our jeans. So that's number one. So now each of these four can be used, and it is appropriate that individual must see a dentist before you know which one is good for you. Thank you very much, ma.
Okay, so in some cases, some individuals while brushing they experience bleeding. So what would you say is the cause of this, and how can it be addressed?
Thank you. This is a very beautiful question, and in fact, I am going to take my time to explain. Normally, anybody that is brushing should not see blood. Anybody that is brushing should not see blood. Once blood is coming in, it means that individual is having something going on in his or her mouth. That is it. Now, any individual that is brushing and blood is coming, it means there is a problem with the gum. So we call it gingiva.
So how can using the wrong toothbrush affect one's oral health, and how can one know the right toothbrush to use?
Thank you very much. Wrong toothbrush techniques can affect the oral health. Let me quickly start this. In our mouth, there are different structures, but all these structures are classified. They are categorized into two. We have the soft tissue and we have the hard tissue. Example of soft tissue is tongue, the lip, all right, both the upper and lower lips, the gum, all right, the palate, especially the soft palate, the pharynx, and other structures we have in the mouth. They are all soft and they are soft tissue. We have the hard tissue also in the mouth. The hard tissue includes the lower jaw and the upper jaw, the teeth, the hard palate, and so on and so forth. Now, using wrong brush, for example, someone who is using very hard brush to brush now, that thing is going to wear away the gum. By wearing away the gum, it is going to expose the root of each tooth, thereby resulting into mobility of those teeth. That's number one. Number two is that, some people, because of how the teeth are formed, so using too hard brush can lead to wearing of the outermost cover of the tooth, known as enamel. So as a result of that, the enamel thickness varies between 2.5 millimeter to 3.5 millimeter. So when they are using hard substance, hard tissue on this thing, so that thickness will begin to reduce, thereby exposing the next layer of tooth material to whatever we put in our mouth, thereby leading to what is known as sensitivity.
Okay, looking in the area of flossing, why is
Okay.
flossing considered essential even if one brushes regularly?
Thank you very much. I really love these questions. And from these questions, most of our listeners will know the importance of visiting dentists regularly. First of all, if you look at how our teeth are being set up, the teeth are set up and there are spaces in between each tooth. If you see two teeth now, there's going to be space there. So when we brush, so the brushing will only take care of this surface, which is known as labial surface, and of course the occlusal surface and the lingual or palatal surface inside. But what of the surfaces in between two teeth? So the surfaces in between two teeth, whether we have eaten salad, we have eaten meat, fish, or any food, they will have, packed in there. So while brushing normally, the toothbrush will not get into these spaces. So dental floss is now made to be able to pass through those two spaces. So, and of course, it is very, very important. Sometimes, if someone is flushing for the very first time, that individual just try and flush and, of course, smell it when you try to bring it out. You can see how, the kind of odor that it will come. You are like, wow, is this thing from my mouth? And it is because we have not been doing it regularly. But if one does it regularly, coupled with normal brushing, it is going to improve the oral hygiene. That's number one. Number two, aside bringing out the food particles that have been in those spaces for a very long time, it is also going to remove any, emergence of cavity in between two teeth. If there is a substance there, that is food substance, the food substance, there is going to be bacteria in the mouth. The bacteria will act on those food substances, but because there is stagnation, the bacteria, the byproduct of the bacteria, which is the acid, all these things, and of course, coupled with the time, they are going to lead to what is known as incipient caries. So from this incipient caries, incipient cavity, that is small cavity. From this cavity, it now begins to go deeper. But if we are using floss, the stagnation that would have occurred, the food particle that would have been there for a very long time, even though the byproduct, the acid byproduct of all the bacteria that might have acted on those food, dental flossing is going to what? Is going to dismantle, disrupt that colony, thereby reducing the chances of having interdental caries known as aproximal caries. That's number one. Another thing which I think we also need to know is that there are different types of flossing. There is one, the floss, it looks like a thread. So you can use that one by using the one with the hand. So you tie it on the index finger on the right and that of the left. So you now support it with the thumb. Then you be putting it in between the teeth, both the upper and lower. But recently, there are now the modernized one that they have made. You will see it now. Most of the time, it has something like a bow and it has the dental floss on it like this. Sometimes it has the distal part that is pointed. Most of the time, people use that distal part that is pointed, and that can be injurious to the gum. So, of course, there are other ones that they are made that the distal part, it is not pointed, it is rounded. So what one needs to use is the end that has dental floss, so that one can slot in between two teeth. Then you can move it down. Then you can now use it to clean. All right. If someone is using it for the first time, one might not actually get it. but it comes with experience. As you are using it often, you realize that this is good. And this dental floss too, we have the plain one and we have the coated one. All this one, they are going to explain it when an individual get to hospital to see a dentist. Well, in a nutshell, using dental floss is very good and it complements regular toothbrushing because it's also part of toothbrushing. Aside this manual, there are other toothbrush. They are designed very small. We call them interdental brush. All right. So there is one that one can use manual. There is one that is powered by motor. All this one can be seen in the hospital if one actually wants to see them. And of course, it is indicated for certain individual. If one gets to hospital, doctor is going to examine. After examining the patient, they are going to see whether an individual is going to use the manual one or is going to use either the power and the electric power interdental toothbrush. Thank you very much.
So what are some of the common mistakes people make when using dental floss, and how can individuals improve flossing techniques?
Thank you very much. One of the mistakes they make is that some people have this belief that dental floss is the same thing as toothpick. That's number one mistake. And the reason is that, the toothpick around has a pointed edge. So if anybody gets dental floss that is being designed, so to them, that area where we are flossing, they are not going to use it. It is the other way around that I've just explained earlier on is the one they will be used. That's first mistake. Number two is that the way people use it, people might not be able to use it. It is better you use them, gently and be able to remove. It's not that you are going to slot it in forcefully, whereby it's going to traumatize the gum and then lead to bleeding. So number one needs to be gentle. One needs to read the manual that comes with it. Number three, one also needs to know whether it is the plain floss or it is the coated floss so that one will be able to know what to use. And of course, dental floss is not the same thing as brushing. Some people will use dental floss thinking that one suffices. No. So you use it to complement brushing. And of course, when we are doing brushing, one must spend at least 2 minutes. At least 2 minutes. Not only that, in between the teeth, we are going to slot it in and we are going to move it out. It's not that we are going to, be moving it forcefully, thereby traumatizing the gums that cover the spaces in between teeth, popularly known as dental papillae. So all these are the mistakes that people make. They make mistake of usage. They make mistake of even how to use it. Some people believe that, why should I even use it? I have a toothpick. So all these things we have been telling people, and I'm so happy that TV360, you have also come out with this awareness. Maybe if our people at home hear more about it, they can begin to reorientate and learn the normal way of using dental floss. Thank you very much, ma'am.
So in the area of mouthwash, what is the purpose of using mouthwash and how does it benefit oral health?
Thank you very much. Wow. Mouthwash, they are substance that is being manufactured. They have antibacterial functions. What does mouthwash, what do they do? They have a lot of functions, and I'm going to only mention few. First of all, earlier on, I said toothbrushing and dental floss, it is to complement one another. But what we know is that as soon as we finish brushing, the bacteria in the mouth, while brushing, their amount will reduce. As soon as we are done, they begin to proliferate. So from there is going to be a coat that is going to cover our mouth from the salivary mucin. From there is going to be, something called plaque will also form. From plaque, for a very long time, maybe between 6 days and 12 days, if an individual is not brushing, the plaque that has already there begin to calcify. Now, this is here we go. in order to ensure that amount of bacteria that will recolonize the mouth, we put them at suboptimal level. We reduce the number of bacteria. That is one of the reasons why we use mouthwash. All right. Some of the mouthwash, they have effect for 12 hours. We call it, they have substantivity of 12 hours. That is, they are going to be in the mouth for 12 hours. They will not allow for bacterial proliferation within that 12 hours. That is why it is recommended that an individual using mouthwash, certain mouthwash, you need to use them twice too. Once you finish brushing, you use them, all right, in the morning. Once you finish brushing at night, you use them. That is for what? That is for you to use it as adjunct to normal brushing. Now, let's say an individual has done surgery. You do surgery in your mouth, and because you have done surgery, that place is yet to heal. And of course, you need to also clean your mouth. So mouthwash can also be used for that. That's another thing. All right. So sometimes an individual may want to do what is known as oral toileting. Maybe there is something going on, or we even want to do a procedure in the mouth. And we can see that this mouth is already dirty. After one must have done preventive mouth cleaning, one can also use mouthwash to ensure that the bacteria in the mouth are reduced. So the effect of mouthwash, it's numerous, but the maker or what their constituents sometimes, if it is used for very long time, can also become deleterious to someone's teeth. All right. I don't want to mention any name, but the appropriate mouthwash is going to be prescribed by doctor if an individual visits hospital. All right. They will look at your mouth. They will look at the one that is appropriate to you, and they are going to write it for you. Why am I saying this? Is that there are some individuals, we call them high risk. That is, this individual, within very small time, they are high risk individual. Thereby, they form cavity in their mouth more than the regular individual. So the way they are going to use their own is going to be quite different from an individual that is not high risk. That's number one. Number two is that, there are some people that are in the city, some are in the village. So access to dentists also matters. All right. Now, all these things are things that doctor will factor in before they are going to prescribe mouthwash for an individual. There are even some mouthwash that contain some element of alcohol. All right. If I mean alcohol, alcohol is a group of compound where we have ethanol, propanol, and the other one. So, an individual that is prone, or an individual that has pre-malignant lesion. So that individual, there are certain mouthwash that individual is not going to use. That is the reason one is not going to go to over the counter just to go and buy mouthwash. No, it is better that you visit your dentist, let them examine your mouth, let them look at everything holistically, because your mouth is not in isolation. Your mouth is part of your body. And the funniest thing about this thing is that the way your mouth looks like shows the kind of things that is inside of you.
Okay, lastly, what role does diet play in maintaining oral health hygiene alongside the brushing, flossing, and rinsing of the teeth?
Wow. In fact, this is one of the best questions and one of the most important questions. As to the whole body, diet is very, very important. As body grows, mouth and the structures in the mouth, they also grow. Do you know that the hardest substance in the body is the tooth? Because it's calcified, and of course, bones too are also calcified. Despite the fact that tooth is one of the hardest substances in the body, it can fracture, all right? It can dissolve, all right, in the acid environment. But what does the diet do? What diet does to the whole body is what it does to the mouth. That's number one. Number two, there are two types of diet that I can categorize as regards as oral hygiene. There are diets that they are karyogenic. That is, the diet that if one eats them, they can make someone's teeth to become cavitated. Cavity can quickly come up from someone's teeth. That's one. Number two, there are diets that are non-cardiogenic. Now, how do we now do all these things? What we preach is that people should stop taking chocolates, biscuits, all those cardiogenic sugar, all those cardiogenic substances. And we warn them that, especially our children that are going to school, majority of them, you give them different things. Those things that we are giving them, we can replace them by using carrots, fruits, right, oranges, beverages, all those things. Let's give them, all right? If at all they want to consume something like that, it is even advised that they should consume it while they are eating. We are telling people to move away from eating what is known as in between the meal snacking. For example, you eat your breakfast, you are going to eat your lunch and dinner. But in between breakfast and the lunch, one would have snacked several times. So snacking several times is one of the reasons that makes someone's teeth become to have cavity. So we are not telling people that if at all you want to snack, let it be fruits. All right. So, but if you must snack, let it be while you want to eat the normal food. All right. That's number one. Number two is that the effect of food is this cardiogenic or these foods that can cause cavity. If someone is consuming them and that individual is not brushing properly, and that individual have teeth that are not positioned uprightly, maybe there are spaces, there is something there is a pit and fissure, all right, on that tooth. And all these things is now going on over the time. Surely that individual will come down with cavity on his or her teeth. So in order to prevent that one, we tell people to eat healthy, to consume fruits, carrots, a lot of something like that, fibers, all right? And of course, we also preach that people should brush twice daily and they must visit their dentist once in 6 months, that is twice a year. Now, visiting dentists twice a year, it depends. If an individual is okay, yeah, that is normal. But if they see that that individual is having high, caries index, they can say, okay, that individual can even see them before 6 months. So it depends on what doctor sees, and that is what they are going to guide or advise the patient on. So diet can be a very good friend of the mouth, and it can also cause bad thing to the mouth. Now, I'm quickly going to talk briefly because some people have considered it as part of diet. Alcohol intake. Alcohol intake is not that friendly to the oral structure. Cigarette smoking. Cigarette smoking, it's not that friendly to the oral structure. Especially anybody that will go and see dentists, anybody that will have to do one surgery or the other, they will normally tell them because this is going to affect them. All
Well,
right.
immediate past
The way
President Lasut Ad, Dr. Selmon Oladapo, thank you for lending your thoughts on the program.
yes, thank you, ma'am.
And that's all we can take on this episode of 360 Health. Many thanks for watching. See you next time.